This video is brought to you as part of the Paired Health Mobile Medical Care Educational Series. In this module of the Paired Health Mobile Medical Care Educational Series, members of the Paired Health Physicians Group mobile care teams share some of their tips for staying hygienic while conducting a full day of home visits. They also discuss some of the things that they make sure to stay aware of, as they never know what the sanitation level of a patient's home will be until they arrive. The Paired Health care teams have picked up on these best practices from their experiences in performing hundreds of home visits over the last couple of years. Something as trivial as sanitation could easily be overlooked when focusing on all the other moving parts associated with delivering care to patients in their homes. In the hospital or clinic, facility sanitation is a top priority. However, when moving to provide medical services to patients in their own homes, there are no regulations or sanitation guarantees. Physician Assistant Jan O'Regan will also briefly discuss how the sanitation level of a patient's home can affect her assessment of their risk level and impact the care plan's timing and frequency of touch points. Can you talk a little bit about what you do to make sure that your hands are clean before and after each home visit? I would imagine that it's a little bit different than working in a clinic or hospital, right? Since you don't readily have access to a sink with soap and water.
Hi, I'm Camille, a care partner. I work with Shelby, a nurse practitioner. We always carry with us in our pocket a gel container. We make sure that when we go to the patient's room, we gel in the same as one would do in a hospital room. And when we're finished seeing the patient, we make sure that we gel out also. We keep the container of gel in our pocket, so for safety reasons, we always gel in and we gel out, and a container in our pocket always makes that possible.
Hi, I'm Janethia O'Regan. I'm a physician assistant with Paired Health. That's very important because we don't have access always to water and soap in the patient's home, and I usually just prefer to use hand sanitizer before a visit, after I examine the patient.
What are some other conditions that you might encounter during any given home visit? And how would you handle them and prevent yourself from exposure to these things?
There's also been situations where there's bed bugs in the home, and so we've luckily known about that ahead of time, but and so you just keep the things you need in a plastic bag and only use what you need to use. But also when we bring the bags in the home, it's always good, and just across the board, just to make sure all the zippers are zipped and you're not putting your bags down or in a place where bugs could crawl into them.
So I'm going to talk about the medical bag and what we use when we go into the home. This is our small stool that fits conveniently in the medical bag, and you can place it anywhere in the home. Also, it's convenient when you have a patient who you want to position yourself in a safe distance from the patient. You can place it anywhere on the floor, and you can position yourself in a position that's convenient for you to work with the patient. The stool provides you a convenient place to sit where there may not be some place to sit in the home. And the best thing is when you're finished, it fits conveniently in your medical bag. You're ready to leave from the home, and you put your stool back in your medical bag, and you leave, and you're on to your next patient.
Is the sanitation level of a patient's home important from a clinical perspective? In other words, can it impact your perceived risk level for a patient and affect the level of care provided or timing and frequency of when you see the patient?
Yes. There have been situations where it was just, there was a very unsanitary condition. We did the assessment outside, actually, at this patient's home, and I really wanted to do a follow-up visit because and see inside the patient's home and gather some more information. So I went back a few days later and saw him inside the home.
Finally, has there ever been a need to perform a home visit in a place other than the patient's home for sanitary reasons or any other reasons?
Yes, sometimes patients don't want us to come into the home, and that's not always found out until we get there. There might be a family member in the home that they don't want to hear their personal information, their health history, and so we've done the visit inside the car. That's happened.
There are countless other sanitation safety tips and best practices to be aware of when conducting home visits. For example, it is extremely important to stock your mobile medical office bag with the adequate supplies so that you're able and equipped to do things like wear disposable shoe covers if the environment calls for it, wipe down all of your medical equipment with sterile pads after each use, properly dispose of used needles and gauze pads in your mobile biohazard sharps box. You can learn more about how to appropriately stock a mobile medical office bag by watching our series module on assembling the contents of your mobile medical office bag. Depending on the structure of your particular program, there may be other best practices which may include things like making note of the sanitation level of a patient's home environment in the EMR chart, or using technology like the Paired Health Provider app to identify certain home conditions, adjust patient care plans based on identifying information inside the home, and set reminders for other providers or clinicians scheduled to see the patient. Thanks for watching, and for more information on identifying psychosocial cues in the patient's home, please check out some of our other series modules where we discuss other types of situations encountered. Thank you for watching this segment of the Paired Health Mobile Medical Care series. Remember to check out the rest of our series and much more at www.pairedhealth.com.